Welcome to this educational video about volvulus, a serious condition affecting the digestive system. We'll explore what volvulus is, its causes, how it affects your body, and what can be done to treat and prevent it. Volvulus occurs when a loop of the intestine twists around itself, and the mesentery, the membrane that supports the intestine. The exact causes of volvulus are often multifactorial and vary depending on the location in the digestive tract. In infants, congenital malformations of the bowel, such as intestinal malrotation, are a primary cause. This means the intestines didn't develop or position correctly during fetal development. In adults, volvulus can be linked to previous abdominal surgeries, adhesions, chronic constipation, pregnancy, or even anatomical variations. Sometimes, the cause remains unknown, which is referred to as idiopathic volvulus. The twisting action in volvulus has two major consequences. First, it creates a bowel obstruction, preventing the passage of food and fluids through the digestive tract. This leads to a buildup of pressure and distension of the bowel. Second, the twisting compresses the blood vessels supplying the affected segment of the intestine. This cuts off blood flow, leading to ischemia, meaning a lack of oxygen. If the blood supply is cut off for too long, the intestinal tissue can become necrotic or die. This can lead to perforation, infection, peritonitis, and ultimately sepsis, a life-threatening condition. The occurrence of volvulus varies based on age and location. In infants, it's a relatively rare condition, but intestinal malrotation makes this age group more susceptible. Sigmoid volvulus, affecting the sigmoid colon, is more common in elderly individuals, particularly those with chronic constipation or residing in long-term care facilities. Cecal volvulus, involving the cecum, is less common overall but can occur in individuals of any age. Geographically, sigmoid volvulus is more prevalent in certain parts of the world, such as Africa, South America, and Eastern Europe, possibly due to dietary factors. The symptoms of volvulus can vary depending on the location and severity of the twist. Common symptoms include abdominal pain, which can be intense and sudden. Abdominal distension, or bloating, is another frequent symptom. Nausea and vomiting are also common, and the vomitus may contain bile or even fecal matter if the obstruction is severe. Constipation is usually present, and patients may be unable to pass gas. In infants, symptoms may include bilious vomiting, abdominal distension, and bloody stools. If left untreated, volvulus can lead to signs of shock, such as rapid heart rate, low blood pressure, and fever. Diagnosis of volvulus typically involves a combination of physical examination and imaging studies. A physical exam may reveal abdominal tenderness, distension, and high-pitched bowel sounds or even absent bowel sounds. X-rays of the abdomen can often show dilated loops of bowel and air fluid levels, indicating an obstruction. A contrast enema, where barium or another contrast agent is introduced into the rectum, can help visualize the twisted segment of the intestine. CT scans are highly sensitive and can provide detailed images of the abdomen, helping to pinpoint the location and severity of the volvulus. In some cases, diagnostic laparoscopy, a minimally invasive surgical procedure, may be necessary to confirm the diagnosis. Volvulus can be classified based on the location of the twist. Sigmoid volvulus is the most common type, affecting the sigmoid colon, the S-shaped portion of the large intestine. Cecal volvulus involves the cecum, the pouch-like beginning of the large intestine. Gastric volvulus is a less common but potentially life-threatening condition where the stomach twists on itself. Midgut volvulus, almost always associated with malrotation, is most often seen in infants. The classification is important because the treatment approach can vary based on the specific type of volvulus. Treatment for volvulus focuses on relieving the obstruction and restoring blood flow to the affected intestine. The specific approach depends on the location and severity of the volvulus. For sigmoid volvulus, a non-surgical procedure called endoscopic decompression may be attempted. This involves inserting a colonoscope through the rectum to untwist the colon. If endoscopic decompression is unsuccessful, or if there are signs of bowel ischemia or perforation, surgery is required. Surgical options include detorsion, which involves untwisting the bowel, and resection, which involves removing the damaged portion of the intestine. In cases of cecal volvulus or gastric volvulus, surgery is usually the primary treatment. For midgut volvulus in infants, surgery is always necessary to correct the malrotation and prevent recurrence. Following surgery, patients may require supportive care, including intravenous fluids, pain management, and antibiotics. While it's not always possible to prevent volvulus, especially in cases of congenital malformations, there are some steps that can be taken to reduce the risk. For individuals prone to chronic constipation, maintaining a high-fiber diet, drinking plenty of fluids, and exercising regularly can help promote regular bowel movements. In infants with known malrotation, elective surgery may be considered to correct the anatomical abnormality and prevent volvulus. Post-operative adhesions can sometimes lead to volvulus, so careful surgical technique and minimizing tissue trauma during abdominal surgeries may help reduce the risk. Early diagnosis and prompt treatment of any symptoms suggestive of volvulus is also crucial to prevent serious complications. The prognosis for volvulus depends largely on the timeliness of diagnosis and treatment. If diagnosed and treated promptly, especially before bowel ischemia or perforation occurs, the prognosis is generally good. However, if there is significant delay in diagnosis or treatment, the risk of complications such as bowel necrosis, peritonitis, and sepsis increases, leading to a less favorable outcome. Recent research focuses on improving diagnostic accuracy and developing less invasive treatment options for volvulus. For example, studies are investigating the use of advanced imaging techniques, such as 3D CT scans, to better visualize the twisted bowel and assess the degree of ischemia. Furthermore, research is ongoing to explore the potential of minimally invasive surgical approaches, such as laparoscopic detorsion and resection, to reduce recovery time and improve patient outcomes.